My military career started out in 2002. I went into basic training, Fort Jackson, then transferred over to Fort Hood. In 2007, I was in Iraq and I was experiencing some issues with my body. Right arm went numb, carried on down to my left leg, and so I was medevac back to the States. I was discharged November 2007, diagnosed with multiple sclerosis.
Sleep disorders are very common amongst almost all people. We do have a higher incidence that we see in our MS patients, probably anywhere from 30 to 60%. A variety of MS symptoms can interfere with a patient's sleep, including pain, numbness, tingling, stiffness, spasticity.
The sleep problems that I have tends to be tossing and turning, numbness in my legs and my arms, waking up in the middle of the night.
Bridget has difficulty falling asleep and then maintaining that sleep, and only getting maybe 4 to 5 hours of sleep at night, which is not enough.
It can be very frustrating, but I've been dealing with it for a while, so I've become used to it.
One of the biggest symptoms that we find with MS is fatigue. And certainly if you add sleep deprivation or sleep disorders into that, that is going to increase the amount of fatigue that patients feel.
It's a double whammy when you have fatigue from lack of sleep and fatigue from multiple sclerosis. I have a very busy life. I'm a parent of 2 beautiful daughters. I am a union organizer and I do vocational training on the side. Fatigue tends to get in the way, but I just push through. When I spoke to my doctor about the experiences that I was having, they advised me to do a sleep study.
Hi, ma'am, you ready?
I'm ready.
A sleep study is a study in the night where we apply small leads to your body and we watch you and hear you during the night to see your movements, and if you are awake during the night, to see how much sleep you get and what is actually going on in your sleep that might be causing you to have awakenings during the night.
When we do a sleep study, we get a lot of data. So we look at the EEG, which helps us determine what stages of sleep a person has gone through. We also record some eye movement data, which helps us understand whether a person is in REM sleep or not. And then we have the breathing channel, which gives us an idea whether this breathing is rhythmic, whether they're having apneas or cessation of breath. So Bridget did not have sleep apnea. The sleep study did show that her sleep was fragmented, meaning that she was waking up multiple times in the middle of the night. Also, her sleep efficiency was somewhat low, meaning the time she actually slept as compared to time in bed was low.
Once the sleep study is completed, we ferret down to see what is it exactly that's going on during the night. If it's getting up to go to the bathroom multiple times, then we look at bladder control. What medications can we provide? If it's leg movements at night, we can prescribe a medication to help with that. If it's stiffness and tightness, generally I'm going to recommend a good stretching program before bed, and then we may use some anti-spasticity medications.
There are a lot of medications approved for insomnia. So the class of drugs which we use most often are called Z drugs. They're sort of subclass of benzos, but not exactly benzodiazepines, with possibly fewer side effects. And then there are a lot of other medications, including some of the sedating antihistamines or antidepressant medications, which are often used for patients who have insomnia.
Generally, they're used for the short term, and it's in combination with cognitive behavioral therapy or sleep hygiene mechanics. They're not something that we want to do on a continual basis. And especially for our MS patients, waking in the morning groggy, if they already have fatigue from MS, isn't going to help them get through their day. We're very lucky here at the VA. We have a terrific sleep medicine department, and they incorporate a psychologist that actually utilizes CBT, or cognitive behavioral therapy. We can actually train the brain to know that when we get into bed, it's time for sleep. If 15-20 minutes goes by and we're not sleeping, we need to get out of the bed.
So we ask them to get up, go to another environment, and do something boring. For example, reading something, but not like a mystery novel. And when they get really drowsy, then they go back to the bedroom. So this way, they're associating sleep with bedroom, not being awake and tossing and turning.
I hope the CBT does me well because I'm not prone to taking medication.
Sleep hygiene is actually a fairly simple practice. We need to go to bed pretty much the same time every night, wake about the same time in the morning. Sleep is much improved if we're sleeping in a cooler environment. And this would be exceptionally important for MS patients who tend to do worse in warm environments. Other aspects of sleep hygiene is definitely some light exercise.
Stretching has helped me tremendously getting prepared for bed.
Also included in sleep hygiene is making sure that we have at least taken an hour before bed to move away from the blue lights of our phones, of our computers, of our iPads.
When we are exposed to bright light, our brains think that it's daytime, so it delays our sleep onset.
Try to turn off the social media, the TV, don't watch the news right before you go to sleep. Give your mind some time to deactivate and to stop worrying about world events. It's much easier to drift off to sleep.
My sleeping coach has spoke to me about sleep hygiene, not using your cell phone while in bed, not watching TV while in bed, that type of thing. So the idea is to be functional throughout the day.
My take-home message would be to encourage patients to talk with their healthcare provider, especially their MS specialist, and let them know what's going on in their lives, and to ask for their help and to let them navigate and guide them to better sleep and better quality of life.
I would certainly advise them to seek help. If their sleep is poor, for whatever reasons, that needs to be addressed.
I think there's every reason to be hopeful. We have so many options now that we didn't have before, and there's so much in the research that shows us how important sleep is.
In the beginning, it was very frustrating not to get to sleep, and when I realized that this was something that was a part of MS, I knew that it has to be something besides medication that can get me to sleep. So going to sleep therapy and doing all those techniques, I believe will help me get the adequate rest that I need.
Right now, it's too soon to tell how everything is going with sleep with Bridget. I think we're headed in the right direction for sure, but I'm looking forward to meeting with her and catching up and seeing how it's been.
My advice to another patient with MS is to find a balance. I'm still working on finding my balance, but I believe once you balance yourself day and night, you will reach your goals.